Namaskar. Today we will be studying Mouth Remedies by Dr. E.B. Nash. Dr. E.B. Nash mentions the remedies Mercurius Corrosivus, Mercurius Cyanatus, and Mercurius Protoiodide as remedies which are majorly indicated for mouth related symptoms or for any kind of mouth related complaint. Hence, we are going to talk about these remedies one after another. Dr. E.B. Nash talks about Mercurius a lot more than he talks about these remedies. There are little paragraphs only that he has written about these remedies, but about Mercurius he talks a little bit more. About Merc Sol he talks a little bit more. And let's see what he has to say about these remedies. While explaining Mercurius, Dr. N.M. Chaudhary gives us the leading characteristics of this remedy, one after another, and he also explains a little bit about the sphere of action of this remedy, and finally he talks about the antisoric, antisyphilitic, and antipsychotic remedies. So let's start with the leading characteristics. The first one being mouth, which is very obvious because this whole group of remedies is itself named as mouth remedies by Dr. E.B. Nash. So mouth forms a very important part and sphere of action of these remedies. Let's see what are the symptoms that are present. So the gums are swollen, spongy, and sometimes bleeding. So gums for a very important sphere of action in Mercurius, and they will become spongy. The texture will differ, and there will be bleeding from these gums also. In the same way as gums are swollen, even the tongue is swollen and flabby, and it takes the imprint of the teeth. So the tongue will take the imprint of the teeth, which is also seen in arsenic, chelidonium, podophyllum, rustox, and stramonium. Right, so arsenic, chelidonium, podophyllum, rustox, and stramonium all have imprint of teeth on the tongues. And then a very important point is mentioned, which is that the mouth of Merc is moist, okay, moist with salivation. So there is this soapy, stringy saliva that they have, and because of which the mouth is moist. And yet, even if the mouth is moist, yet there is intense thirst in this remedy. So normally it's very physiological. If you have a dry mouth, or if your tongue is very dry, your mouth is very dry, then you will obviously feel thirsty. But in this case, the mouth is moist, there is salivation, there is soapy, stringy saliva, but yet along with it there is intense thirst. Now this is something that is characteristic, this is something that is peculiar, and if you find this in your patient, you have to be sure of Mercurius. Okay, you can be sure if you see even one or two more characteristic symptoms of Mercurius in that patient. The odor from the mouth is very offensive. You can smell it all over the room. This is what Dr. Nash tells us. So it is so offensive that it can be smelled all over the room. Alright. Dr. Nash says that no remedy has this condition of mouth in any degree equal to mercury. Okay. No remedy. He says no remedy has this condition of mouth in any degree equal to mercury. It is found in very many complaints, and if anything corroborative of the truth of similia, etc., were desired, the curative power of mercury, when indicated by these symptoms, ought to be satisfactory. So if you want to see the curative power of this remedy, you should go by these symptoms, and you will see and you will be satisfied. You'll see those results. Then he says that many times he has given great relief to many patients of his, and great credit to homeopathy by brilliant cures of a painful condition which is quinsy, and it was guided by these symptoms only. So quinsy is basically the kind of disease in which you have abscess in your tonsils. So in that situation, which is very painful, also this remedy has offered great cures when indicated meaning when these symptoms were present in the patients. Okay, so it is a very important remedy for mouth related symptoms. He also says that, of course, in addition to the above symptoms, the tonsils were greatly swollen and often apparently on the verge of separation in that quinsy case. So these symptoms were present, and along with that, there was separation in the tonsils. It was very, very painful and swollen. Okay. Now, over here, at this point, he also tells us that let me warn against giving Mercurius too low, for if you do, it will hasten separation instead of aborting it. So he tells us that if you give it in low potency, very low potency, then it will hasten the separation. It will even, lead to more pus formation instead of aborting the pus formation. That's what he tells us about the mouth related symptoms. Now let's move ahead and learn about the next leading characteristic that he has told us. Dr. Nash writes that in this remedy there is profuse perspiration without relief of the suffering. So the sweat does not relieve the suffering, but on the contrary, it increases with it. And in which remedies you see that majorly the sweat relieves. So we've already discussed about natrum, we've already also discussed about arsenic, and there is soranum also. So in natramor we had discussed that when in fever, when there were these three stages: chill, sweat, heat. So in the sweat stage we've seen that everything that natramur, all the complaints that natramur had got relieved in the sweat stage except the headache, which was very adamant. But other than that, sweat relieves natramur, right? So in that way, sweat does relieve arsenic, natramur, and soranum. But when we talk about Merc, in Merc Sol you see that there is profuse perspiration. Although there is a lot of sweat, it's not the case that there is no sweat stage or there's scanty sweat, but there's profuse sweat. But even if there's this profuse amount of sweat, it is not relieving the patient's suffering. So the sweat does not relieve. But on the contrary, it does increase it. In any disease, if this is present, okay, if this is present in any disease, then mercury is the first remedy to be thought of, is what Dr. Nash tells us. So if we have this kind of a situation where there is profuse perspiration but there is no relief, then mercury is the first remedy that should come to your mind. Next, he also tells us that these patients are worse at night. This is a very, very famous symptom of mercury, and especially in the warmth of bed. Okay, especially in the warmth of bed and especially at night. Then he has also given Leadham Palace comparative remedies. Okay, worse at night and especially in the warmth of bed. Next, he tells us about creeping chilliness. So he says that when you have cold, right? You have cold and cough. So in the beginning of that acute picture of cold and cough, or in threatened separation, the fever symptoms of Merc are notable, especially in the sweats. So this creeping chilliness especially is felt in the beginning of a cold, okay, when you just have your cold, you just have got it, you've just caught it, and also in threatened separation. And then he also tells us that the fever symptoms of Merc are notable, especially in the sweats, because sweat is increasing the symptoms, right? And that is why obviously you're going to be able to see them clearly in the sweat stage. In the chill stage, which is very peculiar in Merc, it is not a shaking chill that they feel. It is not a, they do not feel the shaking chill, but simply there is creeping chilliness. So there's this different kind of feeling that they have. They have this creeping chilliness in the chill stage also. So three places where we can see this creeping chilliness until now we've seen is that it is in the beginning of a cold, it is in threatened separation, and it is in chill stage of the fever that they have. He talks more about this. Let's see. Here he tells us that the chilliness is felt most generally in the evening. So in the evening it is felt more because obviously it increases into the night because there is night aggravation, as we have already seen. They are worse at night and they're worse by the warmth of bed, if not removed by Merc. So it increases into the night if not removed by Merc, meaning if this patient had chilliness and it began in evening, and you also know the other symptoms that the patient is having and they also match mercury, and you prescribe mercury just before the evening has come to an end, you will see that it does not increase into the night because obviously it is removed by Merc Sol by giving the remedy, right? So normally if you don't give the remedy, if the picture is what you see afterwards, then you see that this chilliness in the evening and which increases into night. This chilliness alternates with flashes of heat. They're first chilly, then they're hot, then they're chilly, etc., just like arsenic. And this chilliness is also felt often in single parts. So these are a few symptoms or few indications that he mentions related to the chilliness or the creeping chilliness that he talks about. Okay. Over here you also add that this kind of chilliness or these kind of symptoms are felt also when the patient has abscesses, okay, or when he is harbinger of the pus formation. Then he says that if this pus has already formed, okay, if there is an abscess that your patient comes to you with and pus has already formed, especially a lot of it, much of it has formed, then the only thing that mercury can do is to hasten its discharge. So the abscess will break open and the discharge will come out. This is what will be the action of mercury on the abscess if there is a lot of pus formation which has already taken place. Okay, but if there is a different situation, but if little or none is actually formed, so you see that there is just this abscess has just begun to form and there is no or very little pus formation that has taken place until now, then a dose of mercury in high potency will often check the formation, meaning will stop the formation of the abscess, and a profuse sweat often follows with a subsidence of the swelling and rapid cure of the disease. So what will happen? If you give it in a stage when there is a lot of pus formation, it will hasten the discharge. And if you give it in a stage when there is no pus formation or little pus formation, it will abort the process of pus formation, or it will abort the growth and development of the abscess itself. That is also something that Dr. Nash tells us. Okay. Then we see the sphere of action of this remedy. So he mentions that it is also very important in skin diseases, especially in those which are aggravated at night and aggravated by warmth of bed. It also has an action on glands and bones. On the glands, it leads to glandular swellings. The glands are cold, they are inclined to separate, and along with that, you have the chilly creepings that we have just talked about. The chilly creepiness, okay, the creeping chilliness, that kind of whole situation will be there. All the symptoms about the chilliness that we have discussed should be kept in mind. And if we're talking about the sphere of action on the bones, it leads to bone pains in the exostosis and caries. Again, the modalities are the same. The modalities are also one of the leading characteristic points that he mentions: aggravated at night and aggravated from the warmth of bed. Okay, so we've learnt about the sphere of action as skin disease, glands, and bones. Next, he also talks about the lower lobe of right lung as the sphere of action of this remedy. Okay, lower lobe of right lung. And there is stitches through to the back, like chelonium and calica both also have these kind of stitches of pain which goes to the back, radiates to the back. And there's this mucous membranes all over Merc will produce discharges which are at first thin and excoriating. They are from catarrh of nose to diarrheic or dysenteric discharges. Any kind of discharges coming out of any mucous membrane will be at first thin and excoriating, and afterwards thicker or more bland, like pulsatilla discharges. And the remedies that Hahnemann has given for syphilis psora psychosis are: for syphilis, it is Merc, which we are discussing just now. Merc is the greatest anti-syphilitic remedy that is famously known. And psora, so anti-psoric is sulfur and antipsychotic is thuja. So this was all about the remedy Merc Sol. Let's just quickly revise all the points that we have talked about. So in the beginning we talked about the mouth, in which we saw that the gums are swollen, spongy, bleeding. The tongue is also swollen, flabby. It will take imprint of teeth. There is this moist mouth because of salivation, which is soapy and stringy, yet there is intense thirst. And there is odor from mouth, so there is intense thirst. Okay, and there is odor from the mouth which is very offensive. You can smell it all over the room. And this kind of mouth symptoms are present, which are very, very characteristic of Merc Sol, very, very important. Especially this point is very important. It is moist and yet there is intense thirst in this remedy. Then we talked about the second point, which was profuse perspiration, which does not relieve the suffering. Okay, so it does not relieve the suffering. There's this sweat which will be there, but on the contrary, it will increase the suffering. It will not relieve, but it will increase suffering. And if in any disease this happens, mercury is the first remedy to be thought of. Any complaint that this remedy has is worse at night, and especially also in the warmth of bed. There's creeping chilliness, which was a very important point. It is, you can see it in the beginning of a cold, in certain suppression, in chill stage also. Okay, it is very peculiar, but the chill stage does not have a shaking chill, but there is creeping chilliness that you see in this patient. So the chilliness that these patients have is actually felt most generally in the evening, and it increases into the night if not removed by Merc. So it is in the evening it starts and it increases until the night. Then there's alternation. First they're chilly, then they're hot, then they're chilly like arsenic, and it is often felt in single parts. Sphere of action, we've seen that it is used in skin diseases. When we have these modalities, it is used in glands and bones. Glands, may there is this glandular affection, glands become cold and inclined to suppress, and there's this chilly creepiness present there also. In the bones, we've seen that again the modalities are present. The next sphere of action we saw was the lower lobe of the right lung, and the symptom is that there is stitches through the back, through to back. Chelidonium and Kalikab also have them. Mucous membrane discharges are such that at first they're thin excoriating and afterwards they're thick and more bland like pulsatina. And these antisyphilitic, antipsychotic, antipsoric remedies is something that he also talks about. Next, moving on to talk about Merc Cor, in which Dr. Nash tells us that it leads all the remedies for tenesmus of rectum. So this is our rectum and anal canal. So this picture is just so that you remember the sphere of action of Merc Cor. It is also on the rectum, on the on the rectum. So there's this tenesmus. What is the meaning of tenesmus? Tenesmus means kind of urge, kind of strain that we that helps us in passing the stool. But this tenesmus is incessant and even stool does not relieve it. So even after doing the stool, even after passing the stool, the urge is not going, the strain is not going, and this is what decides between it and nux vomica and dysentery. So it differentiates. And then there's also tenesmus of bladder that these patients have. This severe tenesmus may begin in the rectum and then extend to the bladder or vice versa. In gonorrhea also, if the patient is at the second stage of gonorrhea, when the greenish discharge is set in and there's burning and tenesmus especially which continues, then you have to think of Merc Cor as the remedy. This is all that Dr. Nash talks about under Merc Cor. Then talking about Mercurius Cyanatus, he tells us that the sphere of action of this remedy is again on the buccal cavity and it cures diphtheria. The throat especially has chronic affections, and this remedy is also efficacious in cases of public speakers. What happens is that the throat feels raw and sore, and when you examine the patient, it reveals a broken down appearance bordering on ulceration. So the mucous membrane will appear like it is bordering onto ulceration. It will just now ulcerate, and it is not granulated but looks raw in spots as if denuded. So this kind of appearance will be there, and it is also efficacious in cases of public speakers. Then Dr. T.F. Allen C. has published a good cure with it, and for that case he chose Merc Cyanatus on account of remarkable prostration. Because of the cyanogen element, there is remarkable prostration in this element, in this remedy, and that is what Dr. Nash also tells us, that this is also one symptom. That is what he wants to tell us. This is also one symptom because it was a symptom that was a key for Dr. T.F. Allen in this case. So it is an important symptom of this remedy, and that's all that he talks about Merc Cyanatus. Talking about Merc Protoiodide, he tells us that the tongue is coated thickly yellow at the base, and tip and edges are red or pale. Okay, so thickly it is yellow at the base, and the tip and the edges are red and pale. Okay, it also takes imprint of teeth, and it is again like Kalibai also has yellow tongue, Nitrum Phos has, Chelidonium has. So it's again the common remedies that they have that have this kind of tongue. In diphtheria, the swelling of the throat and the formation of membrane begins on the right side, like Lyco. And along with that, there is fetid breath, flabby tongue, and it also shows the imprint of the teeth. Again, that's all that he talks about Merc Protoiodide. But two important symptoms he gives us. First, this tongue, which is yellow in color with red or pale tip and edges, and it is also taking imprint of teeth. So almost all Merc remedies are taking the imprint of teeth, is something that we need to remember. And in diphtheria, also we see that it starts or begins on the right side, the membrane formation, just like Lyco. That's very important to remember. And that's all that he talks about these remedies. So we've done talking about all the remedies that we had to discuss in this group of remedies for mouth, which is Mercury, that is Merc Sol, Mercurius Corrosivus, Mercurius Cyanatus, and Mercurius Protoiodide. And I hope we all remember these symptoms and are able to see those as indications in our patients and prescribe these remedies.